when you're thinking about kind of this direct to consumer model, I know that I've heard you speak and talk about this idea of design thinking, and design focused innovation. How do you think healthcare has historically lacked that focus? But also, like, how are you integrating that into your consumer experience strategy and kind of these member identity profiles?
Mm-hmm. Um, yeah, definitely. So as we kind of like you kind of hit upon a very good point around the brokers, and I'm going to connect it to like the question which you asked. Like our CEO, like Dr. Sachin Jain, he has this wonderful idea around like brokers as like community social workers, community health
Absolutely.
workers, right? And to your point, like we do know like a lot of our ethnic population, like especially the Asian American ethnic
Hmm.
population, they do have a great connection with the brokers, where the brokers are in the community kind of helping
Hmm.
them kind of like make good decisions, right? And they are with them throughout their time with the health plan, helping them resolve some of the issues, working along with the health plan. So again, like they have a huge part, and
Hmm.
I believe that their role is evolving to really that
Mm.
community health worker, and as a plan who can really embrace the role of a broker as a community health worker is really where the value and everything kind of comes together,
I'm here for that.
right?
I'd
so
love to see
so
that.
connecting back to your question, like why I believe like healthcare traditionally has been like lacking in the design thinking. um like like McKinsey had a whole article around like how design thinking kind of improves a lot of different things, and what we have seen is the design led companies have a lot more higher like outputs in terms of business outcomes and
Mm.
profitable outcomes versus non-design led companies. And
Hmm.
interestingly or not a lot of healthcare companies are in that top
Mm.
50 list, right?
Wow.
And so why, right? Because I kind of struggle with the similar question, why? And I think there's few things I can think of. Like one is a lot of healthcare is very like clinician centric model
Mm.
versus a patient centric model. And
Mm.
so a lot of the decisions in healthcare are more around like how do we deliver the clinical outcomes
Mm.
without the patient in the center, like what it means really for the member. Perfect example, in one of our research studies, we talked with a member, and I'll call him Ben. And Ben had like recently had a fall,
Oh wow.
and he went to the doctor, and he was telling us the story, and like it was the intervention was all around fall, which is like, oh, you need to do this physical therapy, and you need to
Mm.
do this, you need to take this medication for the pain. And what Ben really wanted was he just wants to go back to line dancing, which is what he enjoyed, right?
Ah.
And so his treatment was, how does Ben go from where he is to line dancing? And if the treatment was in that context, then it would be a lot more effective in helping
Mm.
Ben move to line dancing. And that's kind of where the I feel like the design led thinking is like the biggest area, is like so much clinician focused, and obviously it should be for the
Right.
right reasons. But the key is, how do you get the patient's goals and what the patient is trying to do or the member is trying to do? They are people. So help the people achieve their goals, and their goals are typically not healthcare goals. Their goals are life goals, whether it's spending
Absolutely.
time with their family, doing their hobby, hanging out in the community. And the goal of a clinician or of our health plan as a health system is to help the member achieve their goals.